Heidi, as you peer forward into the future of genomics medicine, what are a few of the opportunities and challenges you see?
So I think one of the challenges that is a big area of focus of my own is we may generate all this data in different places, different hospitals, different research programs, but in order to really understand all of the genetic causes of human disease, that we can optimally direct the best treatments and care of patients with these disorders, we need to aggregate that data, share it with each other, collect additional what we call metadata, which is the clinical phenotypes and the demographic information, even environmental exposures, because both our genes and the environment contribute together to underlie the different diseases that we may develop. And so the best way that we can understand what is causing disease in an individual is to get lots of data, and not just data from our own studies, but data from around the world. So I think one of the challenges that we have to deal with is how we get additional clinical data that is very robust and informative, as well as environmental exposure data, and making sure we collect that in standardized ways in different places around the world, where we can bring that data together in a harmonized way to help understand the genetic underpinnings of disease. That also includes that we can collect and share the genomic data we're generating. And this presents great challenges, not only sharing within our own country between healthcare systems and research programs, but also we want to access data from around the world. So how do I share my data or our data here in the US with other countries in Australia, in Europe, in China? We need to share this data around the world. So I work with an organization called the Global Alliance for Genomics and Health. And the point of that organization is really to develop the standards and policies and other frameworks that we need to figure out how to share data robustly around the world, how to standardize that data so it's interoperable and we can all access and learn and make discoveries from that data that will benefit the global community.
Well, speaking of data, I'm just curious, what role does technology play in the future you're looking to see?
Yeah, technology is a really important element of this endeavor, and it adds a big contribution in a few different ways. One, we need the technology that allows us to, for example, interrogate the genome at scale, and quickly can we generate genomic data on an individual. And the more cheaply and quickly we can do that, the more people we can actually generate this data on, and that will better contribute to our understanding of human health and disease. In addition, we need lots of software application development, informatics infrastructure, so that we can collect the data, share it, access it. There's all sorts of elements of gathering this data that is dependent on introduction of computational systems. That also includes machine learning and other artificial intelligence, because as we generate so much data, we really want to mine that data to understand how different elements of that data contribute to different things we want to study, like human health and disease. And AI approaches will be critical to derive, relationships out of that data that we might not have even anticipated.
It's a theme that I've heard frequently across career fields: data, data, data. And
yes,
it's also in this field as well. Well, as you peer a little bit further into the future, what are some of the breakthrough advances that we might expect to see?
Yeah, so, I think one of the areas that I focus on today is understanding the causes of rare disease. And I don't even want to call it rare disease, because collectively, 1 in 10 individuals is affected with what we call a rare disease. It's just that there are thousands of rare diseases. And these are diseases where a single variant in your genome, or sometimes variants in both copies of a gene in your genome, will give you a very high risk of developing a certain disorder. And we are working very hard to discover all of the causes of rare disease, because these can be very impactful for an individual to be able to diagnose what is causing their disease and help develop treatments and other management strategies to help their health, and also to prevent these diseases from causing serious harm in our communities. So I think, breakthroughs that are happening actually every day are discovering the causes of these different rare or monogenic disorders. So I think that's an area of breakthrough. Another area that has a lot of attention right now are looking at common and complex traits. These are not rare, they're common by virtue of the name. These are things like coronary artery disease, gives you a heart attack, diabetes, obesity. So much of our population is afflicted with these disorders, and we're starting to understand the different genetic and environmental elements that contribute to common and complex disorders like these. And I think being able to stratify the population to say, with these genetic variables, you are at higher risk, and we need to take more aggressive strategies to manage your obesity or your diabetes because there's a genetic underpinning, versus these individuals at lower risk. And it can help target our healthcare dollars for those who are most at risk. And so contributing these genetic understandings are going to be advances that we are seeing now and will continue to be made, where we can use this information to help stratify populations and best treat them.
Someone mentioned to me that our healthcare system is really a sick care system.
Yes.
It sounds like some of the advancements you're talking about would enable us to intervene before it becomes a sick care situation.
That's absolutely right. And we're increasingly doing a better job, although our healthcare system still has a long way to go. We're doing a better job at starting to tackle health in a preventive manner. And we here at Mass General have launched a preventive genomics clinic where we can address patient needs. Either they may describe a family history of disease, but they themselves at that moment are not afflicted, or they just have general concerns. And there's increasing data that shows that population level screening for certain genetic disorders, even in the absence of a family history or evidence of disease, can be very beneficial to patients at detecting disease early so that you can intervene before the downstream bad outcomes of those diseases. That's particularly true for disorders like hereditary cancer or hereditary heart disease like cardiomyopathy or arrhythmias or familial hypercholesterolemia. These are disorders that many people recommend early screening for to prevent disease. And so our healthcare system really needs to recognize that preventive care can be much more cost-effective and beneficial to the health of an individual than waiting till they develop disease when sometimes it's too late to intervene.